I really like Bridge the Gap because it's like a calm and safe place.
So Bridge the Gap is a child mental health support service. We're a CIC based in Derby, and we support children with their emotional well-being and mental health. And we like to do that proactively and preventatively, but we also support children and their families during times of challenge, transition, bereavement, loss. We also have a lot of fun, and we like people to feel good about themselves. So Bridge the Gap started back in 2017 when I founded it based off the back of my own lived experience as a child and young person, but also as a parent as well. So bringing all of that together with my professional background in early years and emotional literacy, which I specialised in 2014. And it made all those difficulties when I was younger, based around the traumas I experienced, make sense, and I understood myself so much more, and I could let go of some of the shame that I felt around those experiences. So because of that, I wanted to create a space that could make a real difference to children in the same way that I needed when I was younger.
But stress that if we put more emphasis on services for children earlier, this may stop many reaching that point.
I'm getting emotional now. Okay. Oh, it's really hard, isn't it? Because it just doesn't happen. Can I take 2 minutes?
Can I ask you why you feel so emotional about this?
Because we're losing children, because we hear every day at Bridge the Gap how children are struggling and parents are struggling, and there's not interventions that are funded that are early and proactive around mental health. And because we care, because suicide rates are high and self-harm rates are high.
I felt like I didn't want to live anymore. I had struggled with anxiety for just so many years, and I didn't understand why I couldn't do the same things that my friends could. I went to other places for about 6 weeks, but I never felt like I'd got to know the person there enough to tell her how I really felt. I also didn't think that Bridge the Gap would be any different, because it'd been years by this point and I'd given up. But I can't explain how safe I felt and how listened to I felt, how I had more time to build a relationship, and I learned that anxiety is so normal. I learned so much, and most of all, I felt less alone, and I could stay and have a future. I now volunteer at Bridge the Gap as a youth volunteer. I can give back to help other young people who felt like I did. I really want to work in mental health and study psychology. Every child deserves this kind of help, and I'm just so happy I got this help myself.
So Bridge the Gap and the work that we do means so much to me because of my lived experience, but also because this is work that has to happen. We are in a child mental health crisis. Our children are struggling, and the world around them is very different to what it was when we were younger. So we have to adapt and really make a difference by helping children to know that they matter, that they're loved, they're not alone, but also to bring lots of hope to difficult situations, that however hard it is, it can change, and it does. And I'm living proof of that.